TMJ is the jaw joint, which sits just in front of your ear, just in front of this little knobble in the ear. It's a joint between your lower jaw or your mandible and the base of your skull. So it's called the temporomandibular joint. A lot of people use that term as a simple way of indicating that they have problems with that joint. The actual clinical statement is TMD, or temporomandibular disorder, and that involves a spectrum of diseases or problems which relate to either the muscles or the joint itself. So many patients with TMD will present with facial pain or restriction of mouth opening or sticking of the joint or locking, or indeed just clicking of the joint. A lot of patients will present to their GP with what they think is ear pain, and this is actually pain in the jaw joint. So the pain is often related to eating and is made worse by eating, or if it's particularly muscle pain and they're clenching or grinding their teeth, which is the common predisposing factor, they will get pain which is worse in the mornings, because a lot of people will clench or grind their teeth overnight and cause the pain which occurs in the mornings. So temporomandibular joint problems are mainly a clinical diagnosis performed usually by a dentist initially, but sometimes GPs are well enough versed to be able to make this diagnosis. Patients will complain, as we've said before, of pain in and around the jaw joint or the ear, and or painful movements of the jaw, pain on eating, or the jaw getting stuck or gradually getting less and less opening. So the clinical diagnosis of that is to feel the muscles around the face. So that's the temporalis muscle in the temple, the masseter muscle here, and over the jaw joint, to see whether you can feel areas of pain and spasm in the muscles, or whether there's pain in the joint, or whether you can palpate noises in the joint when the joint is moved. You would then need to measure the distance between the top and bottom teeth on wide opening. Normal range of movement in 97% of the population is 35 millimeters or above, which is just over about 2.5 inches. So referral onwards should follow a period of initial conservative management, and this should normally be supervised by your dentist. A lot of NHS England guidelines would say that the GP should ask you to see a dentist first before referring you on to a specialist. The specialists that you need to see would be an oral and maxillofacial surgeon with a special interest in temporomandibular disorders, and you can find them out by going onto the BAOMS, the British Association of Oral and Maxillofacial Surgeons website, and looking for the special interest group in temporomandibular disorder, or TMJ, SSIG, and that will give you a list of specialists who will be in your area.